Okay, so people often refer what I think to food allergies as a diverse food reaction. But adverse food reaction is a very broad umbrella that encompasses IgE mediated, or no, I wouldn't say IgE mediated, immunologic response to food allergens, okay? And we have food intolerance that encompasses non-immunologically mediated reaction to food components, okay? Today, we'll be talking about food allergies. I don't like to call those cases as a diverse food reaction for that reason. Adverse food reaction is a broad umbrella that also includes food intolerance, okay? Specifically, we're talking about food allergy and the food-induced atopic dermatitis, because those will be the cases that you see more often. In other words, you see a patient with clinical signs of atopic dermatitis, signs are year-round, you cannot tell based on the signs if the trigger is environmental allergens or food allergens or both, okay? So that's why we'll be focusing on this subset of dogs that can develop food allergies. So I don't think food allergies is a common form of allergies, and you may ask why. Because the gastrointestinal tract has one explanation, an amazing barrier, okay? These barriers composed by the gastrointestinal mucosa that is formed by the epithelium in the mucus, microbiota, trillions of bacteria live in the gastrointestinal tract and have very important functions, including modulating the immune system. The gastrointestinal associated lymphoid tissue participates in that barrier also, and oral tolerance. So if there is alteration in one or more of these components of the gastrointestinal barrier, it increases the risk for food allergies. And there is definitely evidence that that's true in humans. So there is an association, which doesn't mean causation, of diseases that causes increase in mucosal permeability, atopic dermatitis, and food allergies in people. Just one thing to think about. What about skin? Would abnormal skin barrier, again, talking about our patients with atopic dermatitis, in this case, people, they have looked into this, would be a place for entrance of food allergens and sensitization and eventually allergies, okay? So they, within the, I would say, last decade, they are really looking into this in people. So the title, for example, of this first article is, does atopic dermatitis cause food allergy? Because if you think about that, atopic dermatitis, I think in dogs and in people, it's a condition where actually initially you have abnormal skin barrier and an abnormal immune response. Genetic plays a role, right? And then you have that at the beginning. And then you have these environmental allergens and food allergies that can induce really the inflammatory response, but they have all these predisposing components there for that. So that's how I like to think of atopic dermatitis, again, induced by food and or environmental allergens. So here they're saying, can atopic dermatitis, always starts on the skin, okay, then induce food allergies. So meaning food antigens enter the skin, and I would say Dr. Marcella did a beautiful study many years ago now where she used the beagles, laboratory beagles that are sensitized to house dust mite, and she wanted to demonstrate how sensitization occurs, and she exposed them to allergens through the mouth, skin, and respiratory, right? All three. And she demonstrated that, yes, all the three, tell me if I'm wrong here, can be vias of sensitization. So skin too. The case was environmental allergy that she used, but it doesn't matter much. Sensitize the beagle skin because they have abnormal skin barrier with peanut, which they did in people too. See? And orally they manifested. But we're going to discuss at my time. So they developed signs too. It got worse, the signs when you sensitize the skin with peanut. Yep. And in people, again, the most common type of hypersensitivity reaction is the type 1 in people with food allergy. There are other types too. And with peanut, they induce this, I was going to say this dog, these individuals develop urticaria and or angioedema, non-anaphylactic reaction. So, but this is possible, which is very interesting. And again, the peanut, it's a protein, so it's a large molecule there, but it can, in the disrupted barrier, it can penetrate, encounter the right cells there. It's more, again, there is a predominance of a T, we won't get there, the helper 2 cells, and then again, it goes, and so it induces potentially an allergic response. And here is very interesting because, again, look at the second paper. Is food triggered atopic dermatitis a form of systemic contact dermatitis, which is very interesting too. And so that depends on the size for you to have a contact dermatitis of the allergen. But in this paper here, they say there are aptans, very small little molecules that are involved in a contact hypersensitivity type of reaction. They have to bind to proteins. But in additives, preservatives, and other ingredients in food. So this is possible also. Reality is, at this point, we have more questions than answers. And that was people, but we always think, can this happen in our patients? But we don't know. So types of hypersensitivity, we teach that, we talk about that. So in people, types 1, 3, immunocomplex hypersensitivity, and 4, the cell-mediated hypersensitivity. Most cases in people, it's type 1. So they develop, again, urticaria, angioedema, and anaphylaxis. That's why we have to be and can die. So very concerned about people with food allergies. So what about dogs? We don't know. So type 1, yes, we see serum food-specific IgE antibodies, but again, is this just sensitization but not necessarily related with an allergic response? And I say again, in dogs, we don't have a classical type 1 hypersensitivity reaction. So I don't know about this. What about type 4? So maybe type 4, it's a response that occurs more often because when you challenge these dogs that improve on a food elimination trial, so it takes a little while, a lot for these dogs. That's why we do the challenge period for 2 weeks for them to have a worsening of signs if they truly had food allergies to one of the components of the previous diet. So, question mark. Okay, in conclusion, pathomechanism is complex and not fully understood, and abnormal intestinal and skin barriers possibly play a role in humans and in animals. What about the disease? I have to catch up here now because you guys have seen this. So, prevalence. This was published in this paper here, very nice review. They look at the literature, what data was there, and then published for all of us. So they looked at the whole population of dogs that come to a hospital. So food allergy in those cases is about 2%, okay? So, but general, okay, population. Among dogs with skin disease, it's reported to be 0, none, to 24%. Now, if the dog has atopic dermatitis, then it increases that prevalence, okay? And it seems the same in people. So people with atopic dermatitis tend to have more often food allergy than the general population. In cats, it will be 3 to 6% for skin diseases in general, and allergic skin disease, 5 to 13%. Just to give you an idea, I don't diagnose food allergies very often. And again, it's because it's not common in the population of animals that I see, or because the tests we have are not that great. And so, again, published in the same series of publications just on food allergy in dogs. But this is valid for Australia, Europe, and the United States, because that's where the studies came from, okay? So it may not be applicable to you. So because of the population of dogs that you have here, could be different from those places, kinds of foods that they eat, okay? So for dogs, beef, dairy, chicken, wheat, lamb, cats, beef, fish, and I thought it was interesting, the beef, and chicken, okay? So more common things associated with food allergies. In this paper, the authors say, okay, this is interesting because, again, if you are going to do a food trial, the animal responds, and then if you want to do a provocation test to see what these animals can or cannot eat, you could start with those, okay? And so, but again, it doesn't apply to India. India could be the same, but I don't know if it will be. So, signalment, no sex predilection. Breed, because here we're talking about a population of dogs with signs of atopic dermatitis where food is triggering, flaring, and getting that dermatitis worse, okay? So then the breed falls within the breeds that are prone to environmentally induced atopic dermatitis. Age, most will fall within that 1 to 3 years of age. However, when we talk about food, we say, okay, more often than with environmentally induced atopic dermatitis, we see dogs with food allergies falling outside that range. So less than 1 year of age or older than 3 years of age. Honestly, I don't know if I see that, but that's in the literature, and most people really think that that's the case. So cats, 4 to 5, about. So then the disease itself, again, year-round itching is the only consistent sign, and the intensity can vary from mild to severe. Every case is one case. So if you have skin allergy, okay, pruritus should be there. I don't diagnose, I don't even put on my list of differentiation that when I know that these animals are not itchy. And again, it can be mild, moderate, or severe, depending on the case, but it should be there. And in food, because the reason we say that is they are maintained on the same protein typically throughout the year. Even if you change the diets, commercial diets, in most cases, the protein is the same, okay? It may not be necessarily in every single case. I don't know. Okay. Just a second. Did I? Oh, now. Okay. So distribution. Dr. Marcella mentioned this many times today. One thing that helps us dermatologists is pattern of the lesion, the distribution of lesion. This is very helpful. But here again, because we're talking about that specific population, food-induced atopic dermatitis, the distribution will be the sites that we see in dogs with environmentally induced atopic dermatitis. So typically, again, the paws, ears, face, axilla, ventrum, perianal area. Here, look at that. I love that picture because it shows this flexural aspect of the elbow there. So exactly the same as environmentally induced. Food allergens can induce it. Yeah, that's what we talked about. It doesn't like me. Oops, stop. Did I do it twice? So disease progresses, and then we start seeing self-induced hair loss, the inflammation becomes worse, infection comes and add to worsening of the signs, and lichenification, right? So this is just a sign of chronicity, this poor dog. So very similar. I cannot say, if you show me those pictures, I cannot say, okay, is this food allergy or environmental allergy? I cannot tell, because here we're talking about this population of food-induced atopic dermatitis. Then again, infection comes, aggravate the signs, so malassezia overgrows, inducing dermatitis, otitis externa. You well know these patients, I'm sure. And again, they aggravate the clinical signs of food allergies. Just you know this well, so dogs with atopic dermatitis and superficial pyoderma. Those are the most common complications. In cats, year-round pruritus is the only consistent sign also, and the intensity may vary from mild to severe like the dog. In just the cat, again, we know cats like to hide to itch. And so if the client tells you that the cat is not itching, and again, just don't ask, is your cat itching? Because like with a dog, if the cat is not scratching, but over grooming, rubbing, so they may say no, because they understand that response to itch, because it happens with us, is a scratch. Okay, so specifically ask all the behaviors there. But that's one thing. You need to be a little detective there. So clinical presentation in cats definitely more variable. Like with environmentally induced atopic dermatitis, we call it now feline atopic skin syndrome. Yes, it's there. That's another thing that bothers me. You're going to see the differences in clinical presentation here. It's so significant that I have to wonder, really, are all these patients atopic? Okay, so, but at this point in time, yes. If you're taking an exam, yes, it's this, okay? So they can present, definitely, I trust the face and neck pruritus, I think no question about it. Self-induced non-inflammatory alopecia, I'm not going to get there, so miliary dermatitis and lesions of the eosinophilic granuloma complex, and Dr. Marcella showed you pictures of that. Yeah, see, atopic skin syndrome. And that's a new terminology, okay? So relatively new. Again, just an example, these cats can be miserable scratching at their face, the neck area. And it's one of the differentials for you, definitely, environmentally induced or food-induced atopic dermatitis. These cats that overgroom, remove the hair, cause no inflammation on the skin, typically very symmetrical. If it was a dog, depending on the age, you'd say endocrinopathy, Cushing's of hypothyroidism. In cats, no. Even if the owners didn't see them scratching, they did that. We blame their minds. So, I mean, they did that. Oops, I don't. And then miliary dermatitis, those papules, often they have little crusts. This here is not showing as much, okay? Those are, again, quite different manifestations here, right? Same disease, okay? They can be present in other diseases also. Maybe miliary dermatitis can be present in many other diseases. Also, the differential for self-induced non-inflammatory alopecia is very big. The lesions of the eosinophilic granuloma complex, we have the eosinophilic plaque, the indolent ulcer, and that's eosinophilic granuloma. So they can present in many locations and different presentations also. And including linear granuloma that wasn't here. And again, they can be clinical signs of other dermatosis also. When you see those, you always have to try to rule out food allergies, okay? I mean, allergies in general in these cats. But I tend to do that if the cat is itchy. My colleagues may not agree with me, but that's how I pursue these cases. So if they are pruritic, then I say, I'll tell the owners to go through all this and spend their money. If not, I'll treat this as a lesion, an eosinophilic lesion, that I don't know what caused this. Concurrent diseases, dogs and cats can have concurrent diseases, flea bite allergies, or environmental-induced atopic dermatitis, which again will aggravate the inflammation and itchy associated with the food allergic animal. So gastrointestinal tract signs, I wish we had all the cases that had food-induced atopic dermatitis having GI signs, because that would be a marker for us, right? So, oh, GI signs, food-induced. But that's not the case. Okay, so you see all the signs that they can present, and it's reported in about 6 to 44% of the cases. I rarely see that associated with true food allergy. So diagnosis, history and clinical signs always, right? And then rule out other pruritic skin disease. You hate to miss scabies in these pruritic dogs, for example, or cats. Cats have more notohydric, not so much scabies. But, and flea allergies, okay, so remember to rule that out. So, and then a specific test to diagnose food allergies. So, tests to diagnose food allergies, how good are they? For many years, people, I think to this date, they still hope that this test would be good to diagnose food allergy. Imagine how easy it would be for us if it was very sensitive, specific, and for the owners, right? But again and again and again, these tests fail. They are not good tests, either skin or serum test, okay? Skin injecting foods, okay, and see how they react and see if that correlates with what they show to be allergic to, or that's how these studies were done on a food trial, no correlation there, and also sensitivity and specificity of the serum food-specific Ig antibodies is poor. Nope, unfortunately. Now, a few years ago, a colleague did a study where he, yes, actually, like Dr. Marcella does with the plants, he got food, crude and cooked and put it in direct contact with the skin for 48 hours, then remove and try to see the reaction. So, hoping again that will be maybe, I don't think those tests are that easy to do because it's hard to keep all these things we are testing in contact for the skin for 48 hours. So, but what they found, sensitivity, the sensitivity wasn't bad, but the positive predicted value was poor. So if it's positive, are you predicting well that this dog most likely have food? Okay, but the negative predictive value was very good. So the conclusion was, if you do a patch test on a dog with food ingredients, and the foods that the dog did not react to, so that the test is negative, are foods that you can use on a food elimination trial. So that's the value of that. However, I think it's too early to even start doing this, because it's not a simple necessarily test to do. So again, the test wasn't how can I say, standardized. It was one study, so we need more to really show, yes, I reproduced those results. And then maybe standardize the test so we all can do it the same way. So, for trial. Now, what about testing saliva and hair? Do you have any laboratories that claim that they can diagnose food allergy in dogs or cats through hair or saliva? Do you have this or heard about it? So good, you're better than us there. So there are a few laboratories in the United States that they claim that they can diagnose food allergies, again, testing hair and saliva of dogs. And then a colleague said, okay, I will debunk this laboratory. She got one that advertises a lot. So, and what she did, she submitted 10 hairs from one single allergic dog and a normal dog. So 10 hair samples from both, and submitted separately with different names to the same laboratory. And then she got hair from a stuffed animal, submitted that. Okay, there was one that appeared normal. And they submitted the saliva also from these dogs, divided the amount of saliva as separate samples, and water. Believe it or not, they could not distinguish the group, not even from water or the fake hair. Okay, bad. Okay, so no, don't even think about it. Okay. Then we are left with the food elimination trial. That's the gold standard test. But again, this test is not randomized, it's not blind, and so there is bias there on both sides, in my opinion. So I'm not telling you, I'm a little pessimistic about food allergy in general. It's just, it's hard to diagnose, but I don't want to discourage you by any means, okay? But it's just that that's a reality that we are faced now as far as what we have to diagnose food allergies. So, and there are 3 phases: the elimination diet trial, challenge, and provocation trial, if your owner is willing to go with that. So, wow, this is so yellow. Again, start with the elimination and challenge. So you feed the diet that you selected to do the trial, that's another challenge, exclusively. Nothing else goes in the mouth of that dog, otherwise you cannot validate the trial. Okay, very important that owners understand that. Otherwise, it's best to not even do the trial. So I like to send clients, it doesn't mean that they will fill that out, and I gave, where is in the garage? I think a picture of this. It's a visual analog scale, 0 to 10, also vertically, but that it's for each day, 30 days, and we ask them to just put a mark there, horizontal, anywhere where they think the itching level is. It's great when they do that, but not often they do, but we try. And again, I add the diet gradually to avoid any gastrointestinal upset. So you can do first day 25% of the trial diet, then 50%, 75%. Fourth day, he's eating completely the trial diet. So we still recommend 8 weeks. Some people do 12 weeks. No way. I would recommend clients doing 12 weeks. 8 weeks should suffice. And again, strictly, very important. If there is at least 50% improvement, we are looking at the skin. Owner is assessing male pruritus in skin to some extent. Then positive response. Yes, and they do challenge, right? And so you put them on the previous diet. And the challenge period should not last more than 2 weeks. But you can interrupt it and make a conclusion at any time during that period. Okay, so as soon as if they flare, stop. okay? Put them back on the trial diet. They should get better again. And then you say, okay, I'm convinced that this animal has food allergy. If not 100%, but he improved significantly, he probably has environmental allergens too, which we can have both, okay? Yes, challenge should not last longer than 2 weeks. 2 weeks is already a lot. Some dogs will react early, few days after you expose, but some dogs, that's why we go up to 2 weeks, may take that long, okay? So, again, worth within 2 weeks, that again, that food allergies. Again, what is our reality? Here we are recommending an owner to start the pet on a strict food trial, right? These animals are miserable. You checked, no infection, great. Now I want to start the trial. You already addressed that. But they are very itchy. So is that realistic that these dogs, let's say that patient, food allergy is not that common, does not have food allergy. So do you think the owner and the dog will tolerate this 8 weeks? Some people do. The dog itching like crazy, you bet they will be bothering you and they will interrupt the trial. I had clients crying. So, but for many years, I did what was published. I bet most of us do this, right? So you give them glucocorticoids, or if they're already on an immune, it can be glucocorticoid or Apoquel, okay? Because you remove, they flare very quickly, and you add, we have a response very quick. It's Cytopoint, it's not good when you're trying to assess a food elimination trials, okay? So put them on steroids, 2 weeks, stop the steroids and see. They itch again, put them back again. Go for 2 weeks, remove the steroid, see if they flare. And you go that if they are flaring every time you remove the steroids or Apoquel up to 8 weeks, you rule out food, okay? So if you remove the steroid, they didn't itch for 2 weeks, leave a little time, observe that, okay? And then you can say, then again, you challenge. If they get worse, it gets better again, then food allergies. But the steroid is on board, so you can complete that food elimination trying these miserable patients, okay? Make the owner and the dog happy if you do this. And definitely you can make this trial shorter, okay? So with the other way, you could also, at any time that improve, you stop the trial, challenge, and go from there. So, provocation test is to determine what the foods they can or cannot eat. A lot of clients don't want to go with this because it's time consuming. So you have the diet trial, add chicken for 1 or 2 weeks, see if they respond. Beef for 1 or 2 weeks, and go on. So I would love if they did that, because I want to know specifically what these dogs, we would all learn more, are allergic to, but I cannot convince. For many years, I don't even offer that to them anymore. So, but some people do. I think people in Europe do provocation tests quite a bit. So, which diet to use? So, and again, that's such a hard question. If, again, knowing what's in the literature with more and more studies, it's difficult. Again, if you want a novel protein diet and carbohydrate, then the dietary history is extremely important, right? But would clients make notes? I changed this diet, and so would they remember? No. So it's very difficult for us to get an accurate dietary history from owners of these dogs, okay? And so just think about it, okay? Then there is this thing. So cross-reactivity in antigens, okay, between animals that are phylogenetically related, okay? So then you think again, let's say the dog is allergic to beef, and you say, okay, never ate venison, okay? But there is potential for cross-reactivity of those allergens that that animal has become allergic to. And then you fail that potentially, that trial, okay? Because you think you're doing a novel diet, they didn't respond, and so it's because that cross-reactivity. And again, chicken, duck, okay? And then there was this study very recently here. They call theoretic risk of cross-reactivity. So they looked at muscles of animals of various species, different species, and looked at allergens that were known for dogs, okay, based on a previous publication from the same group, and check cross-reactivity. It's amazing. So, like beef, we thought was just venison, cross-reacted to lamb, chicken with fish. So there was some other cross-reactivity. The reason is, what is the significance of that? They didn't test for that, okay? It's just something for you to think about, but we don't know the relevance of that at this point in time. Come on. See, clinical relevance is not none. And again, can I trust the list of ingredients on the food bag of products? That's another thing for you to consider. So you cannot trust, because again, there were studies that looked at proteins and also, I think, some of these animal and plant proteins in these diets by doing ELISA or PCR, and they found proteins that were not listed on the bag. And so it could be contamination during production or part of what they say other ingredients. But again, the amount, how much was it there? Is that relevant for our animals? We don't know. We don't have an answer to that. But it's just said that this happened. Now, one more thing. House dust mites and storage mites in commercial dry food. What is the matter here? So there is extensive cross-reactivity between house dust mite and storage mites, okay? Now, storage mites can contaminate bags of dry food if they are maintained in humid area and if it's very hot. They grow there happily, okay? So then you said, my dog is, and you have a dog back here that's allergic to house dust mite, okay? So the dog is itchy and you're thinking of food, they start that food elimination trial. You remove that diet that's contaminated with storage mite, and the dog gets better. And then you challenge with that diet that's contaminated and get worse. And then you give a diagnosis of food allergy. It's not food allergy, okay? So that dog is actually allergic to house dust mites, which, again, storage mites have cross-reactive antigens, so you're exposing them to storage mites, they will react. Okay, so the recommendation is, because this can happen, if you really trust that your owners are saving that diet in a very dry, the environment is not very hot, they seal the bag after opening well, then it's okay. But ideally, you should recommend owners buying a brand new bag to do the challenge, okay? It's just one other thing for us to think about. No. Okay, that's what I mentioned to you guys. So the matter is erroneous diagnosis of food allergies in atopic animals sensitized to house dust mites exposed to foods contaminated with storage mites. So, yeah, that's what I just told you. So novel protein versus hydrolyzed. So novel protein rely on an accurate dietary history, and I think you believe also that this, it's hard, okay? So we have to think of the allergen cross-reactivity among species, at least the phylogenetically related ones I would be more concerned. The other ones, again, we have to wait to see the relevance. Otherwise, you cannot use anything. So hydrolyze, ideally it should be what we call ultra-hydrolyzed, less than 5 kilodaltons, the molecular weight of the broken down protein. Just carbohydrates are not hydrolyzed in those cases, and palatability can be a problem depending on the diet in the animal. And so what about home-cooked versus commercial home-cooked? No additives, no preservatives. You know what's in there, okay? It's nothing undeclared, so you know the protein, you know the carbohydrate that adding based on, again, the veterinary helping you, not balanced. But again, if it's an adult dog for the period of time of the trial, or cat, then it's okay. Cat, ideally, you should add powdering, okay? Time-consuming. And some clients really think that's time-consuming. And it's hard, again, to find that novel protein, okay? So commercial, it's convenient, it's balanced, but their additives or preservatives, rarely they develop food allergies to those. But again, in people, they have documented that. Not that often, but yes. Undeclared ingredients, we talked about that. Storage might contamination of bags, but again, you have control over that if now becoming aware, okay? So challenge in choosing the right trial diet. Dietary history is often inaccurate, cross-reactivity between proteins of various animal species, undeclared ingredients in dry commercial food bags, and again, dry commercial food bags can be contaminated with storage mites, and if the dog is allergic to houseless mites, that can be a problem. So then which diet to use? I like to use, considering all these factors, ultra-hydrolyzed diet, or hydrolyzed if you don't have, but you do have an ultra-hydrolyzed diet here, which is the the Royal Canin diet. And again, with corn starch, because again, the carbohydrate is not hydrolyzed, but molecular weight of cornstarch is small, so less chance for a reaction there. And now, I don't think you have that yet, but in the United States, one of the companies came out with an amino acid diet. So the protein is broken to the level of amino acid, okay? That should be ideal. So that diet was removed from the market for a while, but it's back now again. So it'll be interesting to see how that diet performs. So it has to be strict, as you know, otherwise don't even do it. Many animals in the house, impossible to separate them, children in the house, those kids don't do it. Do not allow anything go to the mouth of that dog other than the trial diet. Client education, extremely important, okay? So explain to them, these diets are expensive that we are using. If you're not strict, we cannot validate the trial, okay? Sometimes it happens that the dog got into something, they should let us know. And then we make a decision, no, let's keep going with the trial. So, but it's important to educate them. All members of the family should be involved here. Okay, so people should not feel sorry for the dog or want to give a treat in the middle of the trial. Emphasize again the need for challenge at the beginning, because if the dog or cat improves significantly, and then you talk about challenges, some clients said, no, I don't want to make my pet worse. But explain to them that it's important that we confirm the diagnosis by challenge. That's the only way. And I tell them the improvement could be due to something else, changing pollens at the time or something else. And so if you make a decision now that's food allergy. I'm not making a decision that's food allergies until I challenge it. They respond and they get better again on the diet. So you are going to spend quite a bit of money to keep this animal on this diet for life, and it may not be food. And then they change. So management, so avoid the offending diet, try a diet often use long term. So you can do that balance. So avoid gelatin capsules if the pet is allergic to beef or pork. After or definitely during the trial. Good prognosis if the pet is not exposed to the, easy to say, to the offended allergens. What about food allergy-specific immunotherapy? So, and then here we're thinking, okay, IG-mediated hypersensitivity is involved for you to get to the point that you're trying immunotherapy. If you ask me, I would not do it. But this was an interesting study. There were very few dogs. They had 2 groups of dogs where they did immunotherapy with food ingredients, sublingual. So one was a placebo group, the other one was the treatment group with those food allergens. They did it, I believe, for only 6 months. And they looked at pruritus score. Their benchmark for response was at least 50% decrease, and CADESI, which evaluated the extent and severity of the skin lesions. And when they looked and compared day 0 to day, I think it was 6 months, again, end of that trial, the improvement was much better in the treatment group compared to the placebo group. However, none of the dogs in both groups, the placebo improved to some extent too. The pruritus reduced by 50% or more. In I believe 2 dogs in the treatment room, yes, they reached that response, a positive response benchmark. So at this time, I would not do this at all. Their infections are common in aggravated disease. You know all this. So very important that the trial is strict. That's the only, the food elimination trial, strict food elimination, is the only reliable diagnostic test we have currently available, but it's not valid if it's not strict. Okay, yes, finished.